All right, we're here today with Mike, and Mike has come in to get treatment for his knee. So, Mike, how long have you been suffering with this knee pain?
Probably about 3 months.
Yeah, and it's getting to the point where it's unbearable, huh?
Yeah, both knees, yeah.
What is your pain level right now?
7 or 8.
Okay, so it's up there.
It's constant.
Have you seen any other doctors for this?
I have not.
So this is your first attempt to get it corrected
Right.
with no surgery.
Right.
All right, so I am going to have you do a couple different movements. So the first thing I'm going to do, Mike, is just, can you stand up for me? All right, how did that feel, Mike?
Hurts in the back of both knees.
Behind the knee there on both knees?
Yeah.
Okay, how was your low back?
I didn't really feel anything there.
Probably because the pain was so bad in the knees. All right, I'm going to have you take one step forward. I'm going to have you put your feet shoulder length apart, arms straight out in front of you, keeping your heels on the ground. I'm going to have you squat down as low as you can. And slowly come back up. And how was that? I saw it in your face.
Yeah, still in the back of the knees.
Still in the back of the knees?
Maybe a little in the front.
Mike, I'm going to have you go up and down the stairs for me.
Okay.
Okay, so out of those 4 activities that I just had you do, which one caused you the most discomfort?
Going down the stairs.
Down the stairs.
Yeah.
And was it in the back?
And some in the front. Going
And the
down
front.
stairs.
All right, you ready to get this party started?
Let's do it.
Let's do it. Are they being nice to you, Mike?
Yes, they are.
Just checking.
Okay. Traction, nice deep breath, and up. 1, 2, keep pulling. 3, 4, 5, 6, 7. Okay.
Mike, did they beat you up?
Yep, Mike's ready
Just
to
a
go.
little bit, but it's a good beat up.
Good. Mike, I'm going to have you walk down the Hall of Fame here, up and down the hallway for me.
Check out those.
How you doing, Mike?
Doing well.
Good.
Look, he's walking proud.
Yeah, a lot of the pain has gone away.
Anything else feel different?
Feels a lot more flexible, you know.
You're not as
Not as
stiff?
tight, right.
Yeah.
Yep.
Perfect. All right, we're back with Mike, and Mike has finished his treatment with Dr. Davis. So, Mike, let's see what you got. Can you stand up for me?
Yes.
All right, how was that?
That was a lot better.
Because you were experiencing most of the pain in the back of your knee, right?
Exactly. Yeah.
Exactly. Okay.
I didn't feel it.
Step 1 step forward, and we're going to do that squat. Feet shoulder length apart, arms out. How low can you go? Nice. That was a perfect squat, too. Form and everything.
You made that look too easy.
All right.
Can I do that again?
Nice. That was
A
awesome.
long time.
All right, let's go up and down the stairs. Let's see how that feels for you. All right.
Yeah.
So how did that feel?
A lot better. I want to do it again.
He's an overachiever, I can tell.
Yeah.
And look, he's lifting that knee
Yeah,
up.
all the
It looks,
tightness has gone away.
well, it looks like your knee's bending a lot easier too.
Well, he's sure enjoying it.
Yes.
Mike's a happy camper.
Yeah.
Okay, so we started off, what was your pain level when we started?
8,
8. What do you think it is now?
2, 3.
Okay, awesome.
It's just the left. I think is 0.
Okay,
It's just a little in the right.
right, because you were
That was
experiencing
always
both.
Heavy on that side.
Welcome aboard.
Thank you.
Are you happy with
I
today's
am
visit?
happy. I feel great.
Yes, yes.